Most women never reach orgasm from manual stimulation, not because their bodies don't respond, but because their partners are doing it wrong. If you've ever felt unsure about technique, pressure, or timing, this guide will change everything. You're about to learn exactly what works, why it works, and how to apply it tonight. Before we begin, a quick note. I won't be leaving personal contact details. This channel exists to provide free, accessible, judgment-free information for everyone. No gatekeeping, no upselling. Just real guidance you can trust. Let's start with what most people get wrong. They rush. They apply too much pressure too soon. They mistake wetness for readiness. They change rhythm right when things are building. These mistakes aren't just frustrating, they actively prevent orgasm. Understanding how female arousal actually functions will eliminate every single one of these errors. Arousal in women is not a switch. It's a gradual wave that builds through layers. Blood flow to the clitoris and vaginal walls increases slowly. Nerve endings become more sensitive over time. Muscles relax in stages. This process can take anywhere from 5 minutes to 30 minutes, depending on stress levels, hormones, and emotional safety. Skipping this progression is like trying to sprint before warming up. It causes discomfort and shuts down the response. Physical preparation matters more than most realize. Nails must be trimmed short and filed smooth. Even a slight edge can cause micro tears in delicate tissue. Wash your hands thoroughly with unscented soap, scrubbing under the nails for at least 20 seconds. Remove all rings, bracelets, and watches. Keep a bottle of water-based lubricant within arm's reach. This isn't optional. Natural lubrication varies wildly based on cycle phase, hydration, medication, and arousal level. Adding lubricant removes friction and makes every movement feel intentional rather than abrasive. Now, the warm-up phase. This determines everything that follows. Start away from the genitals entirely. Kiss her neck, shoulders, and collarbone. Run your palms slowly down her back, sides, and outer thighs. Use your whole hand, not just fingertips. Warmth and surface area create relaxation. Move to the inner thighs, but keep your touch slow and deliberate. Trace small circles. Drag your fingertips lightly across her skin. This increases blood flow to the pelvic region without triggering defensiveness. With clothing still on, place your palm gently over the vulva. No movement yet, just resting pressure. Hold for 3 to 5 seconds, then lift away. Repeat this twice. The anticipation alone triggers arousal. Next, trace the edges of her underwear with one finger. Move along the leg openings, across the top band, and down the sides. This teasing builds tension in a way that direct touch cannot. When she signals readiness, through body language, verbal confirmation, or pulling you closer, move to bare skin. Begin with the outer labia. These are the thick, outer folds that protect everything internal. Stroke them gently with your fingertips, moving from top to bottom in slow, even lines. No circling yet, just vertical glides. This warms the tissue and increases sensitivity without overwhelming her. After a minute or two, shift to the inner labia. These are thinner, more delicate, and packed with nerve endings. Use the pads of your fingers, not the tips. Trace them from the base upward, applying light pressure. Think of it like smoothing out fabric, not pressing a button. Her breathing will deepen. Her hips may tilt forward slightly. These are green lights. Now comes the clitoris. But here's where most people fail. They touch it directly, immediately, and with too much force. The clitoris has over 8,000 nerve endings in a space smaller than a pea. Direct contact before full arousal feels jarring, even painful. Instead, focus on the clitoral hood. This is the small fold of skin that covers the clitoris. It acts as a buffer, allowing stimulation without overstimulation. Place 1 or 2 fingers on either side of the hood. Move in small, slow circles. Imagine you're drawing the rim of a coin. Keep your pressure light. As arousal increases, the clitoris will swell and become more prominent under the hood. You'll feel this shift. Her body will push into your hand. That's when you can increase pressure slightly. Not speed. Pressure. Try different patterns. Vertical strokes from bottom to top. Horizontal slides from side to side. Figure eights that loop around the hood. Small, tight circles directly over the top. Ask her which feels best. Women vary wildly in preference. Some need broad, sweeping motions. Others want pinpoint focus. There is no universal technique. Communication eliminates guesswork. If she enjoys more surface contact, use 2 fingers pressed together like a paddle. If she prefers precision, stick with 1 fingertip. Pay attention to her breath. When it quickens, you've found something effective. When it steadies or slows, adjust. Her hips will also guide you. If she pushes up, she wants more pressure. If she shifts away, lighten your touch or change the angle. Wetness will increase. But this does not automatically mean she's ready for penetration. Lubrication is part of arousal, not a finish line. Always ask before moving internally. A simple phrase works. Do you want me inside? Wait for clear verbal agreement. Consent isn't implied by wetness or body language. It must be spoken. When she confirms, add lubricant to your fingers, even if she feels wet. External moisture doesn't always translate internally. Too much lubricant is better than too little. Use your middle finger first. It's the longest and offers the best reach. Position your hand palm up, fingers pointing toward her belly button. Glide your fingertip along the vaginal opening without pushing in yet. This relaxes the entrance. Now slide in slowly. 1 inch at first. Pause. Let her muscles adjust. The vaginal canal is surrounded by pelvic floor muscles that can tense reflexively. Rushing causes discomfort. After a few seconds, continue inward until your finger is fully inserted. Curl your fingertip slightly upward toward the front wall of the vagina. You're aiming for the area behind the pubic bone. About 1 to 2 inches inside on the upper wall, there's a patch of tissue that feels slightly textured. Some describe it as spongy or ridged. This is often called the G-spot, though anatomically it's part of the internal clitoral network. Not every woman finds this area particularly sensitive, but many do. When you locate it, press gently with the pad of your finger. Use a come here motion, curling your finger toward yourself in small, repeated strokes. Start with light pressure. If she responds positively through moans, hip movements, or verbal encouragement, increase pressure gradually, but never assume more is better. Many women prefer steady, rhythmic pressure over forceful jabbing. Speed is not the goal here. Consistency is. Your finger should move in a controlled, repetitive pattern. 2 strokes per second is a good baseline. While your finger works internally, keep your thumb or other hand active on the clitoris. This combination, internal pressure plus external stimulation, is what brings many women to orgasm. The clitoris and G-spot are connected through nerve pathways. Stimulating both simultaneously amplifies sensation. Experiment with different rhythms. Your internal finger can move slowly while your thumb circles quickly, or vice versa. Ask her what feels best. If she wants more fullness, add a second finger. Apply more lubricant first. Slide both your middle and ring fingers in together, keeping them pressed side by side. Maintain the same upward curl so both fingertips contact the front wall. The extra width provides a different sensation. Some women find it more satisfying. Others prefer the precision of 1 finger. There's no hierarchy here. It's about her preference, not a checklist. Inside, continue the come here motion with both fingers. You can also try small circular movements or a light tapping rhythm against the upper wall. These variations hit different nerve clusters. Her feedback will tell you what works. If her breathing becomes shallow and fast, if her thighs start trembling, if she grips your arm or the sheets, she's building toward orgasm. This is where most people make a critical mistake. They change what they're doing. They speed up, add pressure, or switch angles. Don't. When you find a rhythm that's working, lock into it. Consistency is everything during the final climb. If she says right there, treat those words like a command. Do not alter your speed, pressure, angle, or pattern. Even a tiny shift can break the momentum. Her body will give you clear signals as she approaches climax. Her hips will rock or push against your hand. Her breathing will turn into short, sharp inhales. She may grip your wrist or shoulder. Her pelvic muscles will start contracting rhythmically around your fingers. These contractions are involuntary. They signal that orgasm is seconds away. Do not stop. Do not change. Keep going until she finishes. After she climaxes, her clitoris will become extremely sensitive. Direct touch may feel uncomfortable or even painful. Reduce pressure immediately, but don't pull away completely. Keep your hand resting gently on her vulva or inner thigh. Light, slow strokes along her hips, ribs, or stomach help her body transition from peak arousal back to baseline. Some women appreciate being held closely. Others prefer space. Pay attention to her cues. Offer her water. Orgasm causes fluid loss and muscle exertion. Hydration helps recovery. Wait a few minutes, then ask one simple question. What did you like most? Her answer gives you a roadmap for next time. Don't ask multiple questions. Don't turn it into a performance review. One focused question shows you care without making it awkward. A few important variations that many women enjoy. The V-stroke involves placing 2 fingers in a V shape on either side of the clitoral hood, then sliding the hood gently up and down without exposing the clitoris directly. This provides indirect stimulation that feels less intense but highly pleasurable. The outer to inner wave starts at the outer thighs, glides inward across the labia, then back out again. This rhythmic movement resets sensitivity between peaks of stimulation. The pressure hold is simply resting your warm palm over the entire vulva with gentle, even pressure. No movement, just presence. This is calming and grounding, especially between rounds of more intense touch. An angle shift can make a significant difference. Place a pillow under her hips to tilt her pelvis upward. This changes the angle of the vaginal canal, making the front wall easier to reach with your fingers. A few critical safety points. If you touch the anus at any point, do not return to vaginal contact without washing your hands or changing gloves. Bacteria from the rectum can cause vaginal infections. If she reports burning, stinging, or sharp pain, stop immediately. Add more lubricant and return to external touch only. Sharp pain is never normal. A warm, stretching sensation may be fine, but only if she confirms it feels good. Not every woman orgasms from internal stimulation. Some need clitoral focus exclusively. Others enjoy penetration but don't climax from it. Both are completely normal. The anatomy of the clitoris varies. In some women, the internal structures sit closer to the vaginal wall, making G-spot stimulation more effective. In others, those structures are positioned differently. This isn't a failure of technique. It's biology. What matters more than any specific method is emotional safety. When a woman feels rushed, judged, or pressured to perform, her body's stress response activates. Blood flow decreases. Muscles tense. Arousal shuts down. Conversely, when she feels safe, valued, and unhurried, her parasympathetic nervous system engages. Blood flow increases. Muscles relax. Sensitivity heightens. Your presence, patience, and attentiveness matter as much as your physical technique. If you found this guide valuable, subscribe to this channel. Leave a comment below. We read every single one and respond personally. This space exists because real, evidence-based intimacy education should be free and accessible. No shame, no gatekeeping, just honest guidance. Go live a good life.